On behalf of Faculty of Physiotherapy, Dr.M.G.R. Educational Research Institute, I welcome you all to this interview session with Dr. Ramakrishnan Ramachandran Sir, Scientist G, retired consultant from National Institute of Epidemiology, Chennai. We are really very proud and privileged to have you here, sir, and we would like to share your experience with us. So, what is ICMR and what are the roles and responsibilities of ICMR, sir?
ICMR, as you know, it's the Indian Council of Medical Research. It is under the Ministry of Health and Family Welfare, and it comes under the Department of Health Research, DHR. It is an apex research institution, and it is the largest health research institution which conducts research in medical field, and also is one of the largest funder for research in medical subjects. So the ICMR headquarters is in Delhi, but it has institutions all over the country. In Tamil Nadu, in Chennai, there are two institutions of ICMR. One is the National Institute of Epidemiology, and the other one is the National Institute for Research in Tuberculosis, NIRT. There is also a field unit of Malaria Research Center, National Institute of Research in Malaria, that is also situated in NIE campus. So these are all the ICMR institutions. Like that, there are regional medical research centers, there are disease-specific centers. So throughout the India, in different parts of the India, different institutions are situated. The headquarters is in Delhi. CTRA is the expansion for that is the Clinical Trial Registry of India. Earlier there was a Clinical Trial Registry platform conducted, International Clinical Trial Registry platform, which was established by the WHO. The idea was to register all clinical trials, and the clinical trials are very important research wherein it gives you maximum evidence for any condition. So transparency and also the utility of the clinical trials should be rather available for all, and that was the reason they said the clinical trial should be registered, and so that one of the things in any of these clinical trial portal is it can be accessed by anyone. So the knowledge that is disseminated through the clinical trials is available for anyone who is interested in that particular topic. Okay, so the CTRI is it has got a linkages with the WHO clinical trial registry, but this is exclusively created for clinical trials to be carried out in India. All the clinical trials which are carried out in India is mandatory that it should be registered in CTRI. So that's the purpose. See, as you know, there is a cancer registry. So many people are doing clinical trials here, there, everywhere. But suppose somebody asks, is there a clinical trial on this particular condition or with this particular drug? There should be some information available somewhere. So that is the role the registry is doing. Okay, yeah.
So what are the eligibility of an academician, sir, to become a researcher in ICMR?
ICMR, it depends on what sort of a project that they are doing and how. Usually the scientist recruitment, it requires a PhD, so you need to be most of the scientists, the minimum requirement is you must have a doctoral degree. And ICMR recruitment, the screening, the rank that they give for the individual applicant is essentially based on the number of publications in international journals, in PubMed referred and indexed journals, and are you principal investigator or a co-author. For each one of them, you have different marks. Okay, and then how many projects that you are PI, and then these projects, how many of them are intramural, how many of them are extramural. Is there any international projects that you have? Are you a PI or a co-PI? Everything goes into your selection criteria. So there are specific marks for them all, and the final interview also has got about 20 marks or so. But 80 marks is decided by your background material itself. Only the 20 marks is for at the time of interview how you are doing. So that's why you should rather have fairly a good profile to get into ICMR. Okay.
So why should we register our trials and CTRI, sir?
Yeah, as I was mentioning, the registering it in CTRI gives you, transparency of your research work. That it has several implications. Like, for example, there need not be a duplication. If you are going to rather do this, some guys who want to rather do a similar research, if he finds that already there are people who are doing on this, they may or may not rather be doing it, number one. And number two, usually when you go with the level of evidence, the clinical trials are supposed to give the highest level of evidence, but more than the clinical trials, it is the group of clinical trials, which is called meta-analysis. Several people have done these clinical trials, and you try to pool all the results of it so that you have a better evidence. Then systematic reviews. So for all these things, for people who want to rather do a meta-analysis or people who want to rather do systematic review, they all need overall have done, and they need some information as what sort of a clinical trial is done. This is number one. Number two, for an individual, clinical trial is very, very systematic research. You need to adhere to a pattern, say what is your selection criteria, what is your, say every damn information you need to rather spell it out. There are certain format in which you have to rather give that. So that rather gives even you a sort of a rigor to your research. Okay, so it helps in making your research more useful, more useful to others, to you as well as to others. Yeah.
So what type of studies can be registered in clinical trials?
Any clinical trials that you do, any clinical trial, in fact any clinical trial prospectively, before you recruit your first patient, you have to register it. Earlier when the CTRI was just started, at that time they were more flexible. They were trying to rather even register halfway through trials also. You would have already done some recruitments, even such trials they were registering. But now, the last rather few years, 18 or 17 afterwards, they register only prospective trials. Before the recruitment of your first patient, you have to register.
How about registering observational studies?
Observational studies doesn't rather come into the CTRA as such, but they do help you in suggesting you some links on which rather you can register. But CTRA is essentially a clinical trial registry.
So is it mandatory for an academician to do PhD?
I won't say it's mandatory, it is desirable, because it all rather depends on where he is employed and what are the service conditions there. And suppose for the promotions, the PhD is a must, he has to rather do PhD. But one of the things in academician, in a research, essentially, his aim should be to create more research scholars. So to creating a research scholar, you should rather complete his research. So in that way, I would say it is highly desirable to do PhD.
Sir, if the same clinical trial has been registered in 2 or 3 registry means, it will be counted as a separate one or same one?
In fact, I know this is one of the frequently asked questions. Even if you go to the CTRI website, they have rather asked FAQs. So one of the questions they ask is if it is registered elsewhere, they have a provision to relate, and it will be counted only as one. It won't be counted as multiple trials. Yeah.
Sir, after registering in CTRI, if you want to make some changes in the details, means how can we make a changes?
Yeah, you can. The only thing is you cannot withdraw. Once you are allotted a number and you are doing, but there is a small change in the protocol, that your protocol change amendments, you can incorporate it. There are provisions there in your.
What is the procedure to get the ICMMR funding, sir?
There is an ICMR. Usually, they call for research proposals. Okay. Sometimes in fact, right now, ICMR has called for a research proposal. They have listed about 15-20 priority areas, and I think April 28th is the last date for submission of these proposals. They give up to 1.5 crores, and it can be up to a 3-year study. So the one thing is you should keep checking the ICMR portal, whether they are, sometimes they may call for a specific disease also, specific conditions also, say some program evaluation or some this thing. They may ask for a specific condition or a specific research proposal. They may invite research proposals for it. Sometimes annually they rather try and depending on the availability of funds with them, they may call for proposals to do. And for young researchers, especially undergrad students, for their research also annually they give a small research grants. Okay, and that is a 3-month. If an undergrad students want to, it is just to initiate and inculcate in him, the research methodology, and then to create interest in him to do research. These small research schemes are also there. Plenty of grants are there, so that large number of people can be benefited out of it. You can ask your undergrad students also to apply for it. Yeah.
Sir, how many trials can be registered by a researcher in a year, sir?
How many trials you can do? Anyhow, if you are capable or if you are handling 3 trials, register all the 3 trials. So there is no upper limit, but your ethics committee may put an upper limit on the number of trials on which you are a PI. Usually the ethics committee do not permit someone to have more than 3 trials as PI, because you will not be able to spend enough time on each one of them. So earlier people used to be PI of several trials, but now there is not more than 3. Usually that's what the ethics committee put. But as far as CTRI is concerned, any trial that you are doing, you register it.
Sir, is there any amount, fees amount to be paid for registration in CTRI, sir?
Absolutely free. It's not just free, it's absolutely free. There is no money involved at all. And just so ctri.nic.in, you go to that website, and initially you click as a new user. Then it asks you several questions like your first name, last name, that, this and all. You fill them up all, and then you submit it. And it says you are successfully, you have submitted your form, and we will get back to you through a registered mail ID. In that registered mail ID, they will give you your reference code. That reference code is very important for you throughout. Okay, for your logging in, and that reference code is used. And once you get into the system, then you can register your trials. For registering your trial, it asks specifically on the various the disease condition, for example, that, this and all, and it is very, very user friendly. It asks you a question, you answer the question. It's as simple as that. Okay.
Yeah. So So, what is the best piece of advice that you will share for the young researchers, sir?
Soko, if it is a single best advice that you want from me, is the first thing is you should develop a passion for research. If you have that passion, then anything is possible. Okay, and if the passion is not there, then whatever you do will not rather have your full this thing. And number two, there is no T20s in research. Okay, research is hard work. You need to do a lot of background reading. Without reading journals, reading articles on a particular topic on which you are doing research is absolutely, it's waste of time, because n number of people would have thought about it and would have already done some work on this, and you may be unnecessarily repeating one. So one of the main reasons for doing research is you want to rather work on something for which information is scarce, not available. How do you know that information is scarce or not available? Only when you do literature work, literature search, okay, you know about it. So a good researcher should have fairly, a good literature work that he should rather have done. I suggest you do systematic, critical review of the research articles in your department. You can have journal clubs, and in the journal clubs you can rather ask people to do a presentation of published articles. You can interact with them. That is the best way to learn. Through that sort of a discussion, the discussion may lead to that reference, this reference, so you may be reading those reference, this reference. So this is a must for any researcher, is keep your eyes, ears wide open and then try and research is not something if you rather very, very small observation also can lead to a very big research. But you should rather have that eye and the tenacity to pursue it. See, these are all some of the requirements for a researcher. What I have rather said is very, very basic minimum. For research is a different ball game. You need to rather have a tremendous amount of dedication if you want to be a good researcher.
Thank you, sir. Thank you for spending your valuable time in sharing an experience with all of us. Thank you.
It's a pleasure talking to a group like you, and I wish you pursue more and more research, and I'm too willing to help you in your career as researchers. Thank you. Thank you so much.
Stay tuned in another mind-blowing session in Dr.M.G.R.Physio channel. Thank you.